please come forward.
Good morning, Kevin Ashley, Coalition California Welfare Rights Organizations. I want to address a couple of issues. One is about the penalties. The reason that we have penalties is because way back in the previous century, hearings were being delayed over 90 days, and you would get a written mandate, court order, do it, and nothing would happen. And 2 or 3 times, finally the judge got pretty upset and said, well, we're going to have penalties now. And that's how we have penalties. And that's why when the resources were down, the penalties went up. And that's the only thing that means, so if the penalties disappear, our clients are going to be victimized because they're not going to get timely hearings and get timely benefits. So therefore, we strongly support the BCP. We've talked to the department about the BCP. We think all of it is justified in particularly bringing the system into the 21st century. A computer from 1977 is just disgusting. And thank you.
Thank you for your comments. And the goal is timely services, so we don't have to pay penalties. Thank you very much.
Hi, my name is Luann Nguyen. I'm with the East Bay Community Law Center. It's not every day that we're on the same side as the Administration and State Hearings Division. Often we're the ones advocating for our clients in front of judges in these positions, and also helping our clients request hearing, which is probably increasing the caseload. But what I have to say is this: I want to put a human face on this, and to say that the program is very large and the resources are limited in the program. And what that means is mistakes are made, and they're made really frequently and very often. And under Goldberg v. Kelly, we have a Supreme Court decision that says public benefits is an entitlement that deserves due process. And due process is one of the key components of our system and of the American system in general. And it's really important that that system be protected, because these people are in underprivileged position where frequently their rights are stomped on every day. And it's important that there are people there who hear them and who make a decision so that, one, people feel that they are heard, and that there is a system that works, that overviews decisions when they are being made. And we find that it's really great for our clients when they get their decisions sooner, even though the penalties that some people get are really great and it goes to the client. But for the overall system, in terms of how it should function and how we like to see it, it's worth it to spend the money to make sure that justice is met, and that it's met timely, and that it's met in a really respectful way, and that the decisions are really well reasoned. We know that what happens in the context of not having enough people is that you get shoddy decisions, and you get people who are stressed and who don't give the clients the patience and the time and the detail and the information that it's needed to withdraw the facts to apply it to the law. Therefore, we support this budget item. Thank you.
Thank you for your comments. All right, if there's no other public comments, this item is recommended to remain open. If we have no other questions, thank you, Director and Deputy Director. We appreciate your hard work, and our thoughts go with you as you continue to work to deal with the resources that we make available to you and get the job done. Thank you. All right. Next, we'll hear from the Department of Social Services. And we're going to hear about Child Welfare Services. Welcome to Greg Rose, Deputy Director, Department of Social Services, and again, Director Lightbourne. Thank you.
Thank you. Greg Rose will do the substance of our presentation this morning, but I just wanted to frame where our child welfare program in California has been coming from and moving to at this point. If one took a look at the service system 25 years ago, it was something that was focused on, quote unquote, putting a child in a safe place while fairly limited services were provided to the parents in the hope of reunification. If reunification proved not to be possible, then and only then, and years may have elapsed, would a process start to look for an adoptive family, and if that worked, that was great. And if it didn't work, then a child was quite likely to wind up in some form of congregate care until they turned 18 and, quote unquote, emancipated from the system, whatever their level of readiness. At that point, there was very limited resources and services available to actually help keep a child in the home, in their own biological parent's home, before the crisis reached a point where removal was necessary. And the management of the program, and frankly the relationship between the state and the counties, was fundamentally a compliance process with procedures. The famed Division 31 reviews, when the state would go in and say, did you? And if you did all the did yous, that would presumably meant it was a good program, almost regardless of what was actually happening. Since then, there have been a number of very positive changes. The importance of trying to keep a child with their biological family if it can be done safely. And even if that's not possible, the importance of keeping the family and child voice in the whole case planning process that follows is something which has been fully embraced. The importance of the child's well-being in out-of-home care, both their developmental needs as a child growing older, as well as services to deal with the trauma that they've experienced as a consequence of coming to this point, is now sort of an understood and important goal. The importance of emphasizing the role of family and non-family kin as caregivers, if there is out-of-home care, as being the preferred route, therefore to have a child in a context where they're probably familiar with the people caring for them, and where there's a bond that includes the bond of affection and family connection. The importance of permanency, that is, every child deserves a family that is willing to make a lifelong commitment to that child, and sort of partly flowing from that and partly flowing from sort of behavioral observation and developmental observation, the realization that institutional care is absolutely the least desirable form of care and placement. If a child is in out-of-home care, it should be used only for a very specific purpose, for a time-limited basis, and as quickly as possible, a child should be transitioning to a home-like setting and have the services follow the child, not put the child in a place so that they can get the services. And finally, sort of the movement from a process compliance approach to management and oversight to an outcome-based measurement system that says what is happening in a variety of domains, including rates of reunification, timeliness, rates of adoption, child well-being progress, tying into both federal oversight outcome requirements and then locally embedded in system improvement plans in counties with stakeholder input that addresses local needs and issues. All of these are to a very large extent in place already, and the processes that are now underway that Greg also expand on, KDA implementation, the continuum of care reform, the California Permanency Partnership, expansion of the existing Title IV-E waiver to additional counties to have more flexible use of federal dollars, and not at all least, are moving forward on the new automation system to replace the existing CWS CMS system to give our county frontline social workers a real tool that operates in multiple realms to do their work. So where we've come from, passing through, and the initiatives that are now, in a sense, deepening and institutionalizing those changes. So with that, Greg.
Thank you.
Thank you, Madam Chair and Senator Monning. Between Director Lightbourne's opening remarks and the details that are in the agenda, there is a fairly comprehensive overview that you've heard thus far. I'd like to add just a few things to that and direct you to the packet of information that I think is in front of you with lots of blue. I direct you just, and even though there's a lot of pages there, I think we can step through them rather rapidly. The slide on page two just simply to describe some terms that you often hear around child welfare, who does what in terms of the state and the counties, and also kind of tries to put into context that foster care is a component of the overall child welfare system. Should pause for a moment, I imagine, and note that May is Foster Care Awareness Month, and you'll notice some of folks in the audience wearing blue ribbons. That's to symbolize that. If you turn the page to page 3, again, it describes a bit more about the role of the state and the county. We often describe ourselves as a state-supervised, county-administered system. Within the continuum of services that are offered through the child welfare system, there's a prevention piece. There's the emergency response to the calls that come into the hotline. There's a component of service that serves families in their own home with some court oversight often and sometimes voluntarily, known as family maintenance, family reunification is the foster care program, and there's a handful of programs that assist youth who have spent a good portion of their time in the foster care system and hadn't achieved permanency yet. If you switch to page 4, it's simply a kind of a graphic depiction of some of the things that Director Lightbourne has said and a number of things that are in the agenda. Just would direct your attention to maybe to the right-hand side of the diagram that talks about the CFSR and the PIP. These are two terms that the feds use for oversight: the Child and Family Service Review and the Program Improvement Plans. And then we have a similar process in the state known as the California Child and Family Services Review and the System Improvement Plans that Director Lightbourne mentioned before. And so it's those items in conjunction with many of the other things we'll talk about today that kind of create our comprehensive oversight system. Would also mention that if you notice at the bottom of the slide, you'll see two different circles that indicate not just child welfare departments, but also probation departments have supervised some youth in foster care. And today there's around 4,300 youth in foster care that are actually case managed by probation departments. If you turn to page 5, simply we wanted to acknowledge the role of the court, and clearly the court provides both due process and an oversight role for local jurisdictions, and would also mention that everybody involved in the court proceeding is represented: children, families, and the county. Moving on to page 6, this simply is an attempt to illustrate a few things. Number one, the federal government has been very interested in this program, as you might imagine, over the decades. But recently, there's been a handful of federal legislation that have guided and shaped the program. First of all, the Federal Adoptions and Safe Families Act created the oversight and outcome framework that Director Lightbourne mentioned earlier. The Child Welfare Services Improvement and Innovations Act really had us thinking more about well-being and not solely about safety issues. And the Fostering Connections to Success and Increasing Adoptions Act allowed for the federal participation of expanding foster care beyond age 18, and also provided for the first time federal support for subsidized guardianship. Just a closer look on page 7 of the Child Welfare System Improvement Act, you'll notice in this framework here of safety, permanence, and well-being, throughout the conversations you'll hear today and in other conversations with the program, it's this framework, safety, permanence, and well-being, that it is the framework that we approach the work in. And this slide just simply describes the way the federal government thinks about safety, permanence, and well-being. Should also note that as we speak, the feds are revising some of their outcome calculations and their oversight process as we sit here today, actually. Page 8 is just a transition to some charts and graphs. On page 9, wanted to give you a sense of scope and flow within the caseload, if you will. The bar on the left addresses about nearly 500,000 calls to the hotline that are responded to by county child welfare organizations. The middle bar describes that about 1 in every 5 of those is determined to be a substantiated instance of abuse or neglect, and about 31,000 of those turn into actually entry into the system. If I can direct your attention to page 10, when you look at page 10, really the takeaway is that the vast majority of the children that are served in the child welfare system come in as a result of neglect, and often that neglect has to do with parental substance abuse issues and/or mental health issues, not exclusively, but the system, as Director Lightbourne initially mentioned, was set up more in a safety perspective, and clearly over 3/4 of the youth served in our system come in for neglect. Page 11 describes briefly the types of foster care placements. Director Lightbourne touched on those, and so I would direct you then to page 12. This pie chart just simply describes when children are in care, where are they placed, and I would say that the 3 biggest parts of those pie charts are family-based care, and would direct you to note that slightly over 6% currently are in some kind of a congregate care environment. On page 13, this is a snapshot of the foster care caseload for the last 5 years. It was a snapshot on July 1. Again, it's just another way to look at the distribution of placement options and where kids are actually placed in the system. You'll notice 2 things about this chart. One is that there's a slight leveling and then a bit of an uptake of about 1.6% in fiscal or in calendar year 13. But you'll also notice that the proportion of youth placed with kin and FFA is the proportion of children placed with kin and in foster family homes and group homes remains relatively steady, and placements in FFAs are slightly declining. On page 14, I would just note that this slide describes where kids go after they've had been touched by the child welfare system. Clearly, what you'll notice is that biggest part of the pie chart is that children come into the system and are most often reunified with their families, and others leave for permanency that include adoption and guardianship. And of the 21% that are adopted, about half are actually adopted by relatives. On page 15, this chart has a lot going on, and it's an attempt to also speak to one of the first question that's in the agenda about what do we attribute some of the caseload decline to. If you note, this chart just has a historic caseload that peaked some time ago at well over 100,000 kids in the system, and declined by over 40% to some 56,000. What you'll notice is we also tracked exits and entries, and those are the 2 kind of dynamics that speak to caseload either declining or increasing. We just direct you to note that in terms of strategies that focused largely on exits, there were back in the late 90s and early 2000s, our subsidized guardianship program known as KIMGAP created an exit strategy for numbers of young people to maintain living with their families and not under court jurisdiction. And similarly, we had an adoptions initiative that focused a lot on adoptions backlogs at the time. If you look at the declining blue line, you'll see that that's the entry line, and in that situation, some of the things that contributed to the the line decreasing was the implementation of differential response, serving children, youth, and families in a substantial way before they actually enter into the system, and then some of our 4E waiver strategies that focused on prevention and early intervention may contribute to that as well. Finally, if I may, on this portion of the conversation, direct you to the slide on page 16, which is attempts to show you a little bit about the youth in our over 18 program. We'll begin talking in the years going forward about, in essence, two populations in foster care: the 0 to 17 population and the over 18 population, with differing expectations, frankly. That potentially a large over 18 population may actually be a sign that youth and young people are getting services that they so desperately need. We'll just focus your attention on this chart. Just explains where the more than 6,700 young people are residing as they're participating in AB 12, and the largest segment of those is in a supervised independent living plan, in a situation where young people make the vast majority of the decisions for their daily routines, and that they use the subsidy in the same way that many young people do. In terms of making their own decisions and et cetera. I would also mention that most of the young people continue to live in family-based settings, if not on their own, and very few. The slice that remain in group settings are largely those young people that have profound and enduring needs that require additional structured environments. The final page I have for you on this, or the next to final page I have for you on this presentation, is it attempts to address just the relative dollar values for each of the placement types. So these dollar values can be kind of corresponded back to the chart on the previous chart. The final page that I have in front of you is just a list of again, a reiteration of the list that Director Lightbourne described about a number of things that are happening in the world of child welfare today.
Thank you very much for the excellent overview. May I just ask one quick question? Would you venture to say then that the independent living program has been very successful?
The supervised independent living program. I think it's a little early to say. I think its success is that a number of young people have non-minor dependents have resources that they wouldn't ordinarily have. We are in the process of working with philanthropy and Chapin Hall at the University of Chicago to evaluate outcomes related to the after 18 program, and I think I think. To the degree that you think about success as young people who are in foster care having some of the same opportunities as young people not in foster care, I think you could think that the supervised independent living program portion of the program is successful. But I think we do need to take a look at the living situations that some of the young folks happen to be in, and better understand if they're getting if they have service and support needs that may not be being met.
Okay, thank you very much. Senator Monning.
Thank you, Madam Chair, and appreciate this comprehensive overview. In our material at page 14, the chart that shows the percent of children in foster care as of January 1st, 2012. So it looks like that's, the data is from 2012. Any change over 2013, even if we don't have precise data? I think I recall that one of the long-term objectives is to reduce the group home reliance. This looks like about 10% are in group homes. Any change in that you know of over 2013, or is it roughly still about 10%?
It's slightly under 10%. I think the snapshot from my slides and the snapshot here just are somewhat different time periods and include slightly different denominators. So, but we have seen a decrease in group homes with a net value of around 1,000 over the last few years. I have to check the specific numbers.
And am I correct in assuming that for the young people who have the connection with probation, are they more likely to be in the group home setting?
Yes, you're kind of forecasting some of the conversations that are questions that are later in the agenda, but certainly of the roughly 4,300 young people in probation that are in foster care, over half of them tend to be in group homes. I think one thing to think about when you think about group homes and probation is that sometimes the group home is actually the placement of among the least restricted environments when you think about camps, ranches, and the juvenile justice facilities. And so,
so that's part of the spectrum we need to consider.
Yes,
right?
yes.
Thank you.
Thank you very much. Department of Finance, any comments? Legislative analyst? All right, thank you very much. Public comments on these items? All right. Thank you very much for that presentation. And the next item is KDA implementation.
And I believe we're going to be joined by our colleagues from the Department of Healthcare Services.
Yes. Welcome. We have joining us Dina Cocos-Gonzalez, Chief Program Policy and Quality Department of Healthcare Services. And I'm sorry, that's the only name I have on my agenda. So please introduce yourself. I want you all to know that sometimes I don't have the names, and that's the only reason I don't introduce you. So my apologies when I don't. If you'd be kind enough to introduce yourselves for the audience.
Thank
for
you.
us up here too. Thank you.
Karen Baylor, Deputy Director of Mental Health Substance Use Disorders for the Department of Healthcare Services.
Welcome.
Good afternoon, Madam Chair. I'm Dina Cocos-Gonzalez with the Department of Healthcare Services.
Thank you very much.
Madam Chair and members, Greg Rose again from the Department of Social Services. I think I'll start off the discussion around KDA implementation, and then we'll be joined with some additional comments from my colleagues at Healthcare Services. Just a quick reminder, although we've testified many times in many places about KDA, I think it's safe to say that largely this is a lawsuit that was about getting mental health services for children and youth in foster care. What we like to say is the right mental health services for the right youth at the right time. And the agenda has a number of all the kind of factoids that led up to it, and including the things, important milestones in the settlement agreement. What I'd like to talk with you about today is a little bit about where we are relative to implementation, given that we're in the final year of court jurisdiction. So we've always described KDA implementation in essence as, especially during the court jurisdiction phase, as a launch. So in other words, it's important during the time that the 3-year time period that we were working with the court and plaintiffs' counsel is so closely, that we put in place a number of fundamental and foundational processes so that we can sustain the launch for the long haul. And so that's those kinds of things that I want to talk about, these foundational policies, practice, trainings, and quality assurance systems that are being developed, some in place, some to be developed a little bit later. And that we would always say that the evolution and the kind of culture change that's required to serve young people in this coordinated fashion from two disparate service systems will take some time. We're happy to tell you about where we are now, and I'll launch right into that. So in terms of some of the foundational kinds of things, in 2012 we produced and released both the Medi-Cal documentation manual and a core practice model guide. The former kind of speaks to a number of the technicalities related to the specific services that are required by the lawsuit, intensive care coordination and intensive home-based services. And the former guide really speaks to the context in which those services should be planned for, delivered, and monitored, that include a strong consumer voice. In addition to those things, we've conducted 5 regional orientations with counties. We continue to host regular technical assistance calls for counties initially on a weekly basis and on a slightly less often basis now, but where we engage with county child welfare and mental health staff to problem solve and to work through implementation activities. We've repurposed a number of our training and technical assistance contracts to support county staff in these areas, especially where state staff is limited and that we have the ability to provide supplemental support through these activities. We've worked with counties on readiness assessments, service delivery action plans, and established a mechanism for reporting their successes and their challenges. We've established three regionally based learning collaboratives and a small county learning collaborative, and inclusive in those are 17 different counties who do 2 things, or the value in my head is at least for 2 things. One is to help us all at the state level and across the counties figure out the best way to implement these services in the context of the core practice model and deal with many technical issues. But also it's very important because there's lots of peer learning that happens in these regionally based collaboratives, and it provides a lot of support and creativity to serve the young people and their families in the way that we intend. This summer, we have a large convening that we expect more than 1,200 folks to attend that includes child welfare people, mental health practitioners, providers, consumers alike, that will continue to forge forward towards the implementation that we desire. Then I would say that we've also established a number of task forces that require recommendations. Much of that work is ongoing, and the departments will respond to those recommendations later in the summer. A couple of things that I think are important to talk about at the state level, since most of the conversation prior some of it had to do with the county level stuff. The settlement agreement requires the Department of Social Services and the Department of Healthcare Services to establish a shared management structure. And while we're still awaiting the formal recommendations from the task forces, I think it's important for you to know that a nascent shared management structure has been in place for some time, and it includes monthly conversations and meetings with the directorates and leadership from the departments, and much more frequent and ongoing conversations between staff in my shop and at the Department of Healthcare Services, and a number of joint policy letters and guidance have been released. So while we await those recommendations, I'm here to assure you that the beginnings of the shared management structure are in place. The second part of the question, the first question that you asked us to talk about, are some of the challenges that are faced with implementation. And in my head, the challenges kind of fall into 2 buckets or 2 categories. One is a technical one, and in those areas, what folks are grappling with are, identifying the subclass members, asking for policy clarification, largely and oftentimes around confidentiality and data and information sharing across the 2 systems. There's been the need to make some changes in IT systems, and there's also a need to create or revise some contracts locally. The other bucket, if you will, of challenges that folks are confronting and are grappling with are what I like to call cultural or potentially organizational change management kinds of things. And so what that really has to do with is these attempts to align policies and procedures around referrals and other practices from these 2 systems. It's about learning the lexicon of each other's system and learning how to better communicate across systems. It involves joint trainings and development of cross-system teams to better serve young people and their families. It really is a lot of the core practice model implementation is a big cultural change, and that I would also add as a challenge that folks are grappling with. And then And then there's certainly the need to make sure that locally there is an adequate supply of providers that can supply the intensive home-based services, the intensive care coordination, and soon the therapeutic foster care. At this point, I turn it over to my colleagues from the Department of Healthcare Services.